Thank you so much, Dr. Bender and Dr. Moore. Up next, we have a provider, one of our top referring providers, who attended the symposium last year. So he's here to share his experience, and welcome, Dr. Anthony Smith.
Hello. Hi. I'm just curious, how many other people attended last year's meeting down at Jekyll Island? Good. Good. And how many people are from the Augusta area? 1, 2, 3, okay. And is anybody actively involved in Augusta at the the memory clinic at the medical college? Okay, good. All right, I'm a family physician. I've been practicing for a little over 40 years. I was in the Navy, was in private practice in several areas, and I've been in private practice in Augusta now for about 33 years, with having now transitioned into a position with Wellstar in the Medical College of Georgia. And I say that just to say that I've been around a while and I've seen the transition of things that have happened in my career from the time when we barely recognized the causes of dementia to now to an exciting time when we have the potential for diagnosis and treatment. And I throw that out because when I first started, the perception of primary care family medicine was that we just took care of moles, colds, and sore holes. And so, you know, and to a degree, that's true. But the breadth of what we do now and what we're responsible for is overwhelming, you know. And you can get the idea that the person who is a kind of a skilled person or someone who's a jack of all trades is a master of none. And that's the perception you can get, and we sometimes feel that way because we have so much that we have to do and so much we're responsible for and so much to keep up with. But the one thing that we are experts in are our patients. You know, I've had patients now I've been seeing for over 30 years, and they've aged along with me. I've seen them develop into their illnesses, to their terminal illnesses, to dementia, and the challenges of treating them, you know, is rising. But there's also the fact that I know them, I care for them, and I love them. You know, those are the things that we do when we have patients, and that's one of the reasons I love what I do, is because of a relationship. You know, the thing that I see almost every day, I see somebody, because of my population of patients, who's got some kind of cognitive deficit. And that's why I was so excited last year to go to the meeting down there and to get exposed to the new things around there, but also to educate myself and to motivate me to take care of my patients. I think one of the things in the past, you know, when we had the anticholinergics things come along, it was exciting to have something to treat people with. And I remember a time when we were actually importing Namenda from Great Britain to treat one of my patients because the patient had access and was interested in that. And so to come to this time when we have some really potential treatments is exciting. The thing, my experience last year was not only for the education, but also some of the training we got. And one of the most interesting things we had last year was an improv lesson. We had some of that, you were here, remember that, and that has helped me tremendously, and I think they alluded to that a little bit earlier in one of our previous talks about, you know, just rolling with it sometimes, you know, going along and saying that, you know, well, that's okay, you know, oh, those kids you see out there, they're just playing. I experienced that myself because my father had end-stage dementia, and for the last year, until his death earlier this year, I was kind of primarily taking care of him. So I experienced it on that side too, and I was able to implement some of those skills that I had. I refer patients to the memory clinic at MCG and have tremendous response from them and the help. And I don't know about the newer treatments and things because I think, as far as I know, because I work in infusion also, the first experience we've had of Leqembi was actually this past week, and it was actually on a patient who is the father of one of my practice partners. So, and I don't know, and that's the reason I was wondering about the depth and other experience that may have been had there. So we're looking forward to seeing what's going to happen with that particular patient. I think that, you know, some disappointments I've had, and some of it's related to my father, who, just like I said, died in '94. His local physician in the small city that he lived in, you know, was not necessarily responsive to being aggressive about treatments and also referrals and things. And I think that's just a lack of education, and hope we can get out and get that education out to folks. The other thing I had a disappointment with, because of my age, to keep my privileges, I had to go see a neurologist and have a mental status exam and a cognitive exam done. And I was a bit offended when I was asked to do that because of my age. You know, actually it was kind of good because I learned something, and I became a little more empathetic of what people go through. And as I was leaving, I was asking this young neurologist, who was pretty much 2 or 3 years out of training, about what his thoughts were about new diagnostics and new treatments. And I was kind of taken back a little. He was a little reticent. And I don't know if that's because of those people, the training they've had, because of the things we've had about the contraindications and how difficult it was. But he was kind of not very enthusiastic about it. And I don't know in the neurologist community if people are seeing that across, but I was a little bit taken back by that, because I think, you know, I was getting a little more motivated and a little more, you know, excited about the potentials. So I think the one thing that I learned last year coming out of that we're on the threshold. We're right now on the precipice of doing some exciting things. And I think the excitement, if you can take that and generate that and get that back to your colleagues, and also perhaps, you know, reach out to the Georgia Memory Net for resources to bring those into your communities, is going to be a tremendous thing going forward. And it's an exciting time to be practicing medicine, not only just for this. I mean, you know, you think about the things that were happening with our cancer treatments, and thinking about the things, now we have some opportunities to prevent, you know, end-stage renal disease. So it's an exciting time to be practicing. And I think we should take that excitement, go forward, take it to our communities, and talk up Georgia Memory Net. Okay? Thank you.
Thank you, Dr. Smith. It is now break time. After the break, you'll be going into your breakout rooms. And so